Most people think that you will have symptoms to indicate that you might have some underlying coronary artery disease. The truth of it is about 55 to 65% of people are completely asymptomatic in the 24 hours immediately prior to having a major cardiac event, a heart attack. Historically, people will present with chest pain, they get imaged in the ER, some sort of additional workup, but that is just one set of the people. About 50% of people over the age of 40 have coronary artery disease and don't even know it. This is a type of patient where we can catch them before they have symptoms, we can prevent the outcomes. A lot of people are familiar with something called a coronary artery calcium score. What that is it's a scan without any dye, no contrast to the heart. And we do a CT scan going right through the heart to see if you have calcified plaque. Now, this is a good screening tool. It does not show us the higher risk non-calcified plaque, but if you have a good amount of calcified plaque, there is a high probability that you also have non-calcified. So we use that as a screening tool to get a coronary CTA, or at least one of the ways to screen for a coronary CTA indication. A coronary CTA, this is, if you take your basic calcium score, just looking at calcified plaque, a coronary CTA does significantly more. It'll look at your coronary arteries to see how much narrowing you have, how much plaque is there, the calcified, the non-calcified. We can do things, something called FFR, where we can actually see whether or not your narrowing of your blood vessels is restricting blood flow, and if you might have to have intervention going to the cath lab. We can even now look at the total amount of plaque that you have in your coronaries and put a numeric value on that, which is just tremendous because this is a type of patient where you can track changes over time. If you have a patient that has plaque in their coronaries and you're treating them medically, you image them again in a couple of years and it's getting worse, well, guess what? Your management is not working. It is still progressing. So by using your plaque quantification in a coronary CTA, we can tailor therapies for that patient and hopefully not only just stop the plaque in its tracks, but in many cases actually reverse plaque these days. We offer that at every location that can perform a coronary CTA. It is not an additional scan, it is a post-processing analysis. When a patient has a coronary CTA, if there is between 40 and 90% stenosis, that exam will get sent to HeartFlow for additional analysis, performing FFR. And the way I think about FFR, and anyone who sees this who's into the medical field, they're gonna say that I'm oversimplifying it, but I think about it as like plumbing. So when you have a clog in your drain, at what point does the water start to back up into your sink? When you have a narrowing this much, more, if it's spanning a foot, at what point does the water actually back up and restrict the flow? I don't know. FFR is a way to quantify that to see whether or not the narrowing in your vessels is actually restricting blood flow that may warrant a further intervention such as a coronary artery stent. So there's no additional scan needed. You get it off the coronary CTA, sent out for different AI processing, and it comes back with the results. We offer these procedures at many RadNet locations. In order to perform a quality coronary CTA, you need to have state-of-the-art CT scanners, very specific protocols. We identified the best of our scanners, and we direct patients to these facilities to perform those scans. A coronary CTA, the actual scan itself is under a minute. Contrast, the dye goes in, about 20 to 30 seconds later, they perform the CT scan. That only takes 2 to 3 seconds, and then you're done. So it's very quick actual scan acquisition. It's a little bit different than a calcium score. A calcium score, you don't have to have the dye come in, so you don't have to have an IV placed or anything like that. That also only takes a few seconds to scan through the heart. You even have some scanners these days which will image the heart in one single rotation, so in less than a second. So it's very, very fast.